Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You start by verifying the vial label, lot, and expiration to avoid mistakes. Once confirmed, wash your hands thoroughly and set supplies within reach. Put on gloves, remove vial cap, and clean the rubber stopper with an alcohol swab using circular motion. Let it dry. Prepare the syringe and needle. Pull back plunger to the volume equal to dose plus 0. 2 ml air to help withdraw smoothly. Make sure you have a stable surface and good light before you invert the vial and insert the needle straight through the center of the stopper at a 90-degree angle to reduce coring. Once done, inject air into the vial equal to the intended dose to balance pressure, then draw medication slowly to the mark. Pull back until the plunger rests at the exact dose. If you see air bubbles, tap the syringe to collect them at the top and gently push a small amount out until the measurement is accurate. Make sure the tip stays submerged while drawing. You withdraw the needle from the vial, and if you will not use it right away, either engage a safety cap or recap using a one-hand scoop technique to avoid a stick. If immediate administration follows, proceed per injection instructions. Otherwise, label the syringe with drug and time and store per guidance. Dispose of the used needle and vial in an approved sharps container. If resistance, leakage, or unexpected cloudiness occurs, do not use the vial. Replace supplies and notify a clinician as a troubleshooting step.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.